All right, so this is our health subsector presentation. Okay, so a quick introduction to healthcare nonprofits. Nonprofit health organizations make up a large portion of nonprofits in the United States. Around 60% of nonprofits in the United States are healthcare related. They have a better reputation than for-profit health organizations in terms of the distribution of funds. And that's because nonprofit organizations, their leaders don't profit financially from any donations that they receive. And these organizations are responsible for access to affordable health care. They are responsible for educating people and doing the research to get the data to educate people. So just a quick overview. So nonprofit hospitals make up a significant portion of nonprofits in the healthcare sector. There are around 6,000 hospitals in America, and about half of those are nonprofit hospitals. And then we have our other organizations that distribute funding to people in need, such as the American Cancer Society. They distribute funding to cancer patients. They pay for lodging, any sort of transportation, some treatment that they may need. We have the American Hospital Association, and of course the World Health Organization is a very big one as well. Employment within the health sector. The nonprofit health sector is responsible for employment of millions of qualified individuals, and according to the Federal Bureau of Labor Statistics, about 8.3 million people work in the health subsector. And according to recent data, those numbers continue to rise. They give their workers quality benefits, usually, such as 401k matches and good healthcare plans. And most nonprofit organizations want to give those things to their employees as an incentive to work for them rather than a for-profit organization. They create lots of volunteer opportunities for people with any kind of experience. And they provide opportunities for growth within those fields, such as promotion, educational experiences, but a master's degree is typically required to move up in the healthcare field. In terms of revenue, there's different ways that nonprofits in the healthcare sector get revenue. So tax exemptions are very important. They're exempted from state and federal taxes on donations and such. Fundraisers are a big one, and usually if you go on to a nonprofit's website, it will say, would you like to donate? They get a lot of philanthropy contributions in large quantities, and in hospitals, they will have wings named after the person who donated such a large amount of money. And then they also have research grants, and the government allocates a certain amount of money to be able to put that towards research of a disease or educating people about some sort of health problem that's going on currently. And the history of healthcare for nonprofits. The American Public Health Association is the first nonprofit healthcare organization that was established in the United States. It was established in 1872 and founded by Dr. Stephen Smith, and he lived in New York City. He was a commissioner, an attorney, and a surgeon. So he was very qualified. They largely focused on scientific research and educating the public about diseases, and currently it is the largest nonprofit healthcare organization in the world. And they laid the groundwork for future nonprofits in the healthcare field. And these are my references.
Hello everybody, I'm Fabian Font, and today we will be doing a presentation on the unique features of nonprofits within the health sector. And before we start, obviously I have a lab coat because it's stylish. Anyways, moving on to the introduction. Alright, so the health sector of nonprofits boasts a multitude of unique features. In this section of the PowerPoint, we'll be discussing what makes this sector so fascinating. Now, types of organizations. The health sector is home to a number of different organizations, each organized into particular groups. Nearly all nonprofit organizations can be sorted into four main groups. First of which is general health. The first one worth mentioning are facilities that deal with general health problems. These could be local, like nonprofit hospitals and health support services, to global organizations like World Health Organization, which provides medical aid to hundreds of countries. Mental health and crisis interventions. These types of organizations aim to aid individuals who are victims of abuse, mental health issues, alcohol and drug addictions, and etc. Diseases and disorders. Some organizations focus on specific diseases and aim towards treating them. These are usually international and often aid third world countries, like the spread of malaria. Medical research. Certain groups put all their efforts into finding treatment and even cures for diseases threatening mankind. These groups rely highly on public funding, but not much of but, but so much of their research is undeniable. So this works in correlation with the third one. Anyways, moving on. Service recipients. Now, there is a number of service recipients because we all get sick, first of all. But second of all, the health sector of nonprofit services a wide variety of individuals. People who are struggling or going through financial troubles are often the ones most serviced. Nonprofits allow all individuals, no matter what background, to receive the care they need. We'll be focusing more on why it's so important in a future slide. Anyways, moving on to some challenges and policy issues. So, in recent years, nonprofit organizations have faced a few drawbacks. Lower government funding plays a vital role in this recent decline. Nonprofits rely on this money for staffing predominantly, and although volunteers provide much of the foundation for these organizations, paid staffing is still a necessity. Kevin Halloran, senior director at Fitch Ratings, states, "It's unclear if nonprofit hospitals will get back to consistently healthier margins of 2.5% and 3%, or if they'll be lingering at or slightly above 1%. Moving on to the next slide. So, why should we support nonprofits? Now, the answer is quite clear. So, to support nonprofits is to support our community as a whole. Being able to support communities all over the country and even the world means supporting more thinkers who could come up with new ideas to advance humanity, and that affects all of us as a whole, obviously. That's why it's so important. And yeah, that's about it. That's the end of the presentation. And I'll see you guys around.
Hello, everyone. The need for nonprofit healthcare system grows greater by the day. In fact, the advantages and benefits of nonprofit healthcare systems cannot be overstated. They operate within our community and also respond globally to disasters, outbreaks, and other diseases that are affecting countries or communities in need. As the data supports, healthcare is not getting any cheaper. US healthcare spending grew by 4.1% in 2022, reaching 4.5 trillion. In fact, healthcare spending accounts for 17.3% of the nation's gross domestic product. Let's look at the education and awareness benefit of nonprofit healthcare. Take, for example, the Florida Covering Kids and Families nonprofit. They play a vital role in helping families to navigate the complex process of securing healthcare coverage. Let's look at other names such as the American Heart Association. They focus on cardiovascular health awareness, Susan G. Komen Foundation, which promotes breast cancer awareness, and Mental Health America, which advocates for mental health awareness and support. An important benefit of nonprofit healthcare system is allowing healthcare access for all. Take, for example, the FQHC Clinic. These are federally funded clinics that operate in underserved areas, providing vital healthcare services, and also community-based programs that offer free screening for conditions such as cholesterol, diabetes, or cancers. Nonprofit healthcare systems operate on a global scale. Specifically, in a global emergency response, let's take a look at Doctors Without Borders and the Red Cross, and they often provide relief assistance to populations affected by disasters or conflicts. Um, and for an example, during the outbreaks such as the West African Ebola crisis, the World Health Organization played a vital role in containment, awareness, and prevention of the disease. What's really beneficial about nonprofit healthcare systems is that they go beyond the traditional approach. From a community standpoint, they do a lot more by utilizing volunteers to foster emotional and mental health and also focus on substance abuse recovery. They're also pivotal in fostering collaboration between organization, communities, and government agencies. Nonprofits help to bridge the gap in the traditional healthcare system. They are focused on social factors of health such as housing, education, and employment. They're also very data driven. In fact, health outreach is much more effective when practiced locally. Nonprofits are effective in doing so by empowering individuals with knowledge, which enables them to make better decisions and therefore reducing the likelihood of severe health issues.
The nonprofit organization we selected for our group project is Doctors Without Borders. Doctors Without Borders, or simply MSF, was founded in 1971 by a group of French doctors and journalists. It was originally created as a quick response to medical emergencies after the Nigerian Civil War, as well as the flood in Bangladesh in 1970-71. MSF's original focus was centered around providing medical aid in conflict zones and areas affected by disasters. However, over time, as the organization continued to grow and provide support in areas which needed it, the areas of focus and available assistance also continued to grow and expand. Currently, the association has an international presence operating in over 70 countries worldwide and is mainly made up of doctors and workers from the health sector who have all made an impact around the world. All of the MSF workers share the same goal, pursuing the principles of MSF. The main MSF principles are directed by medical ethics and the principles of independence and impartiality. Doctors Without Borders has grown from a quick medical response team to a group which provides humanitarian services ranging from simple access to medicine to natural disaster response and even social violence and appropriate relief. Throughout its history, MSF has been involved in numerous efforts where its members were crucial to providing aid at a desperate time of need and necessity. These have become key milestones in MSF's history that helped it evolve into the organization that it is known as today. We added multiple slides with infographics showing how much of an impact Doctors Without Borders has had on a variety of difficulties, ranging from their response to COVID to their help with the war in Ukraine, and finally a slide showing their work in the Central African Republic. As far as the question, why does MSF stand out in the health nonprofit subsector? The previous slides show only a glimpse of what Doctors Without Borders is doing on a broader basis. As we mentioned, MSF operates in over 70 countries and boasts more than 40,000 personnel, who are constantly providing critical medical care and relief. Besides their strong beliefs in the MSF principles, the staff are known for putting their own lives at risk by traveling to some of the most dangerous environments. Their focus on previously sidelined people helps motivate others to try and make some kind of difference in their own community. These worldwide efforts help ignite a spark that's needed for some individuals to put words into action and make a difference. MSF is also known for efforts in advocacy and speaking out against abuses or inadequate treatment of war refugees and displaced people. This focus on ethical yet realistically funded healthcare is exactly what makes MSF stand out in the nonprofit subsector and will continue to help them grow as an organization. Thank you.